I need a new one.
Happy Wednesday Wellness. We're just talking about our sweatshirts, our favorite shirts.
Yep.
We need more, obviously.
Sporting them, always.
Always.
Okay, this video is for parents with toddlers with tantrums.
Yeah.
Toddlers with tantrums.
Woo.
Woo, it's a hard time.
Woo.
That's for real. So, if you're someone who, you're like, I don't know what to do anymore for my child, we could help.
Yep. So let's talk about tantrums. What causes them?
Usually it is some stress, some dysregulation in the nervous system, sympathetic dominance.
Yes.
What does that mean?
Yep. So that sympathetic dominance is like our fight or flight response. Fight, flight, or flee, or freeze.
Freeze.
Tripping over my words today.
I like flee though.
Flee and freeze. But that's how we respond to stress and kind of just like our monkey brain or our, which is kind of toddlers, right? They're like learning how to function in the world. And so their stress response is like fight or flight. It's a tantrum.
Yeah, and they get stuck there. Because not all toddlers, actually. Sometimes you see some real pleasant toddlers. But, if they're stuck in that fight or flight, then they
have a hard time.
They have hard time
out of it. Yeah.
Emotionally regulating.
Yeah, and usually those like lots of tantrums and stuff go hand in hand with not sleeping and not digesting food very well too, because we're sympathetic dominant, so that means we're not doing all the parasympathetic things that we should be doing. So then it kind of creates this cycle now I'm not sleeping, now I'm feeling extra moody, now I'm having an even harder time breaking out of my tantrum cycle.
Right.
And that like emotional regulation and stuff too.
Or like maybe they're a little like sensory also.
Absolutely.
Like, my socks driving me crazy. But like where you could be like, I can just help you.
Yeah. Like this environmental input is triggering me into the sympathetic response too.
Of just having a meltdown.
Yep, exactly.
And it's like, can they get out of the meltdown, or are they in their meltdown for way too long? That becomes like this extreme thing.
Yep, exactly.
Also, this can be like toddlers, but it can also be 7-year-olds, 9-year-olds. Like, it can happen throughout.
It can be adults too.
It can be Annie.
Yeah. I know if I don't sleep, I'm cranky.
Yeah.
Yeah.
Like, ooh, watch out for Annie today. Anyways, how does your child get stuck in that sympathetic dominant state? Can start as early as back as prenatal stress.
Oh yeah.
Pregnant with baby, you have a stressful pregnancy, you got sick a lot during pregnancy, you have a high risk pregnancy, you have a stressful job, you have a stressful home life.
Maybe you moved, maybe something stressful happened. Yeah.
Baby's getting all those stress hormones, so it's already pushing that baby before they've been born into a sympathetic dominant state.
Exactly, because then they're coming into the world thinking like, I need to like be in fight or flight. I'm coming into a stressful world, I need to protect myself.
And so and then also the birth process, like was the birth traumatic? Did you have a really long labor? Was baby in bad position? Did we push for a long time? Did we need a vacuum assist? Did we need an emergency C-section? Did we need forceps assist? Did was baby just down in the canal for a long time?
Yeah, all of those things kind of like are precursors then and like build up that stress.
Yeah, that's also like stressful for baby. Did the heart rate drop? Stressful on you, stressful on baby. A lot of physical stress that also pushes us into a sympathetic dominant state.
Exactly. And then as we're babies, were we stressed out, or did we have colic? Did we have digestive things? Were we not able to like sleep and wind down then? And now then we're toddlers, did we fall a lot? We're learning to walk. There's a lot of like stressors that can happen in that early childhood.
And that colic and those digestive issues, those gas issues, those reflux issues just kind of grow out now into these emotional regulation issues.
Yes.
In older kiddos.
Exactly. Yep.
They didn't grow out of it. They grew into some other sort of sympathetic dominant stress.
Dysregulation. Yeah.
That shows up now as like big outbursts of tantrums.
Yep. Or like the sensory stuff, like you said, too. So what do we do about it?
Like, usually like conventional medicine, maybe you're going to medicate, maybe you're going to do behavioral therapy, maybe we're trying OT. I'd say OT over PT, right? Like, and all those things can be really great and they can help some, but then usually like if you start there, they usually get to a point where they kind of stop helping.
Yes.
Right.
Yep.
Yeah.
Yeah, because again, we're not addressing that underlying like, stress cycle.
Right.
Yeah.
Yeah,
so
we're not. So
the best way to do that, I mean, we measured in our office. Getting adjusted helps stimulate a lot of that parasympathetic activity, helps break that stress cycle.
And we're finding like where that started in the nervous system too. Like we can see with our scans, like this is the area we need to focus on. This is like the major area. Let's correct that.
And then that becomes kind of the foundation for like, how do we build on top of this?
Yeah. And like maybe your kids still need some other therapies, but now those therapies work better because they can regulate better. And
and they can like
process it better.
Yes, they can process it better. They can use those tools better because, again, when you're like in fight or flight, we're not thinking about like, how do I get myself out of this cycle? Whereas like if I can regulate better and I can break myself out of that cycle, then I can be like, okay, what tools do I have to better regulate this?
And we hear it in here all the time. Like maybe these kiddos, we have kids that haven't, have just been under care consistently because like their parents have brought them in maybe since they were babies, and they grow up and maybe they're not in as consistent anymore. And all of a sudden the parents are like, oh my God, I have to get them in. Like their emotions are, woo. They get adjusted, like, oh my gosh, they come back and I think that, wow. Yeah. Glad that's all that was. Yeah. Glad that's all that was. Like that helped. Like, wow. Exactly. They just needed to be adjusted. We hear that. We had a new kiddo start that's 8 that's dealing with a lot of emotional regulation issues. Yeah. He just started, so I'm excited to see how this can help him. Yeah. See a lot going on. Yep.
I think that's what I got.
That's all we got. That's all we wrote. We can help if you're like really frustrated and just feel burnout, and how to help your kiddo.
Yeah. So, and maybe you should get adjusted too, because that's going to help.
It's going to help you.
Yeah.
Regulate
if you're like,
also.
Yeah. If you're like overstimulated by your child's overstimulation.
It's a real thing.
Yeah.
I feel
absolutely.
that deeply.
Yeah.
I feel that deeply.
I mean, if your child's in fight or flight, parents are going to be in fight or flight too, right? Yeah.
Unless you're really regulated somehow. Okay, so if you're like, oh my gosh, yes, this is what I've been looking for, call our office, text us, message here. We'll get you set up for those scans, a new patient appointment, sit down and talk with you, see if we can help. And we'll offer it half off for finding us here.
All right. Happy Wednesday.
Enjoy your Wednesday.